SLE. Most common autoimmune disease, chronic multi-system inflammatory disease, autoantibodies against nucleic acids, histones, ribonucleoproteins, and other nuclear materials. Deposition of circulating immune complexes containing antibody against DNA host. Symptoms: the result of type 2 or type 3 hypersensitivity reactions, more common in females. The clinical manifestations: arthralgias or arthritis, vasculitis and rash, renal disease, hematologic changes, cardiovascular disease. Manifestations may wax and wane and affect all body systems. Difficult to diagnose. Laboratory diagnosis based on positive ANA screen. Vaccines, general principles and virulence. Biologic preparations of antigens that stimulate production of protective antibodies. Long-lasting immunity. Primary immune response is short-lived. Boosters and injections push immune response through secondary responses, create large numbers of memory cells, creates sustained protective levels of antibody or T cells, and there are CDC schedules. AIDS. AIDS is the most advanced stage of infection caused by human immunodeficiency virus. HIV depletes the body's Th cells, creates generalized immune deficiency. Epidemiology: blood-borne pathogens. Heterosexual activity is most common worldwide. Women affected by HIV and AIDS more often. Structure: retroviruses. Genetic information is in the form of RNA. RNA packaged inside a capsid encased in an envelope along with reverse transcriptase, integrase, protease. Envelope displays glycoproteins 120 and 41, which is GP120 and GP41. The life cycle: attachment to a target cell, Th lymphocyte using glycoprotein 120. Viral capsid released into target cell cytoplasm. Viral RNA inserted into target cell's genetic material. Formation and release of new virions. Have some host cell membrane, less vulnerable to adaptive immune attack. Clinical manifestations: serologically negative, no detectable antibody. Serologically positive, but asymptomatic, positive for antibody against HIV proteins. Early stages of HIV: mild and nonspecific symptoms. Resemble influenza, disappear after 1 to 6 weeks. AIDS: more serious signs and symptoms, atypical or opportunistic infections and cancers, debilitating chronic disease. Diagnosis of AIDS: decreased CD4 T cell numbers, so less than 200. Treatment and prevention: antiretroviral therapy, which is ART, a combination of chemokine receptor inhibitors, HIV fusion inhibitors, reverse transcriptase inhibitors, HIV integrase inhibitors, HIV protease inhibitors. Death reduced significantly and it's not curative. Benign means it grows slowly, it's encapsulated, non-invasive, well differentiated, low meiotic index, do not metastasize, named according to the tissues from which they arise: lipoma, fat cells; lymomia, smooth muscle of uterus; meningioma, meninges, may progress to cancer; neoplasm, a new abdominal growth of tissue in some part of the body, especially as a characteristic of cancer; malignant, cells grow in an uncontrolled way and can invade nearby tissues and spread to other parts of the body through the blood and lymph system. They grow rapidly, not encapsulated, invasive, poorly differentiated, high mitotic index, can spread distally, which is metastasize, named according to the cell type for which they arise. Carcinoma is epithelial cell, adenocarcinoma, duct or glandular tissue; sarcoma, mesenchymal tissue; lymphoma, lymphatic tissue; leukemia, blood-forming cells. In situ, in the original place, early stage cancers, pre-invasive epithelial tumors of glandular or squamous cell origin, have not broken through the basement membrane or invaded the surrounding stroma. Outcomes remain stable, progress to invasive and metastatic cancers, or regress and disappear. Cancer staging. 0. There is a group of abnormal cells I can't read that. Stage 1. The cancer is relatively small and contained within the organ in which it started. Stage 2. The cancer has not spread into surrounding tissue, but the tumor is larger than stage 1. Sometimes stage 1 means that cancer cells have spread into lymph nodes close to the tumor. Or yeah. Stage 3. The cancer is large and may have spread into surrounding tissues and lymph nodes in the area. Stage 4. The cancer has spread through the blood or lymphatic system from where it started to a distant site in the body, so metastasis. Routes of metastasis. Direct spread is local, invasion of lymphatics, perineural invasion, venous invasion, arterial invasion, and serous spaces. Embolic spread, lymphatic blood transcolomic epithelial line spaces. Cancers related to tobacco, most important cause of preventable cancer. It's linked to cancers of lung, liver, urinary tract, upper aerodigestive tract, stomach, kidney, pancreas, cervix, uterus, and myeloid leukemia. It affects nearly every body organ. Also harmful: environmental tobacco smoke, ETS, cigar and pipe smoking, electronic cigarettes. Hypersensitivity reactions. Type 1 cause immediate response after exposure to an antigen. Response: body produces an IgE antibody, causing histamine release from mast cells. Antigen triggers can include food products, nuts, shellfish, soy, animal sources, cats, rats, bee stings, environmental sources, mold, latex, dust, allergic conditions, allergic rhinitis, asthma, conjunctivitis. The flow: allergens, the B cell antibodies or IgE, mast cells, and basophils, cytokine histamine, allergic reaction, anaphylaxis. Symptoms: onset less than 30 minutes, rash, flushing, hives, itching, edema, wheezing, shortness of breath, rhinitis, stomach issues, nausea, vomiting, tachycardia, loss of consciousness. Treatment: adrenaline, glucocorticoids, and histamine, antihistamine. Type 2, production of autoantibodies, IgM, against its own cells or tissue after exposure to environmental irritant. Some cells are coated with autoantibodies, opsonization, and are targets for phagocytosis because the immune system perceives its own cells as foreign. Since the immune reactions involve tissue-specific antigens, they cause healthy cells to die, cytotoxic reaction. Thrombocytopenia, hemolytic anemia, neutropenia. Graves' disease, thyroid, Goodpasture syndrome, kidney, myasthenia gravis, muscular. Antigen triggers: penicillin, thiazide diuretics, cephalosporins, blood transfusions. Symptoms: onset 5 to 8 hours, immediate reaction, rash, anaphylaxis, urticaria. Treatment: glucocorticoid steroids, cyclosporin agents, immunoglobulin infusions, plasmapheresis. Exchange bad plasma for good plasma. Type 3, immune reaction, IgG, against specific cells or tissues of the skin, joints, vessels, and kidney after exposure to environmental irritant. IgG antibodies bind directly to the offending agent and foreign antigen-antibody immune complex. The reaction causes polymorphonuclear leukocytes to flow into the site and cause tissue damage to blood vessels, resulting in a cell vasculitis, causing serum sickness, syndrome of joint pain, stiffness, rash, fever, face swelling. Arthritis reaction, vasculitis caused by a repeated exposure and formation of immune complexes in small vessels. Post-streptococcal glomerulonephritis. Lupus, SLE plus ANA. Rheumatoid arthritis, RA plus ANA plus RA. Antigen triggers: drugs, penicillin vaccines, gluten fungi serum. Symptoms: onset 2 to 8 hours, immediate reaction, inflammatory response of the affected body system. Treatment: antihistamine, steroid, NSAIDs, biologics, Rituxans, Benostol, DMARDs, methotrexate, hydrochloroquinolones. Type 4, T cell mediated, causing release of cytokines when exposed to antigen. Causes activation of macrophages and cytotoxic T cells. Occurs in 2 phases: sensitization phase and effector phase. Results in a delayed response to antigen. Common causes: PPD, poison ivy, chemicals, topical medications, metals such as nickel. Causes: contact dermatitis, type 1 diabetes, multiple sclerosis. Symptoms: onset 12 to 4 hours, delayed drug reaction, rash, urticaria. Treatment: steroid cream, glucocorticoid, antihistamines. Treatment for disease such as TB. Vascular disease. Chronic venous insufficiency, inadequate venous return over a long period due to varicose veins or valvular incompetence, venous stasis ulcers. Thrombus formation in veins, obstruction of venous flow leading to increased venous pressure. Thrombus attached to vessel wall. Thromboembolus is detached. Factors promoting thrombosis. It's the triad of Virchow. Venous stasis, venous endothelial damage, hypercoagulable states. Others would be cancer, orthopedic surgery, trauma, heart failure, and immobility. Superior vena cava syndrome. Progression, occlusion of the superior vena cava leads to venous distension of upper extremities and head. It's an oncologic emergency. Aneurysm, local dilation or outpatching of a vessel wall or cardiac chamber. True aneurysms, weakening of all three layers of the wall. False aneurysms. Well, that would be a non-weakening. Extravascular hematoma that communicates with the intravascular space. Aorta is most susceptible, especially abdominal. Causes include atherosclerosis, hypertension, can lead to aortic dissection and rupture. Thrombosis formation. It's a blood clot that remains attached to the vessel wall. Risk factors include intimal injury, inflammation, obstruction, or flow, pooling, or stasis. Thromboembolus, arterial thrombi. Emboluses, bolus of matter that is circulating in the bloodstream. Dislodged thrombus, air bubble, amniotic fluid, aggregate of fat, bacteria, cancer cells, foreign substances. Peripheral vascular disease. Thromboanginitis obliterans, which is Berger's disease. It's an autoimmune disease of the peripheral arteries, strongly associated with smoking, characterized by the formation of thrombi filled with inflammatory and immune cells. Thrombi become organized and fibrotic, results in permanent occlusion of portions of small and medium-sized arteries in the feet and hands. Causes pain, tenderness in the affected area. Can often lead to gangrenous lesions and amputations. Raynaud phenomenon. Episodic vasospasm in arteries and arterioles of the fingers. Less commonly, the toes. Primary. Vasospastic disorders of unknown origin. Secondary. Raynaud phenomenon. Secondary to other systematic diseases or conditions. Collagen vascular disease. Pulmonary hypertension. Hypothyroidism, long-term exposure to cold environment, changes in skin color and sensation. Peripheral artery disease, atherosclerotic disease of arteries that perfuse the limbs, intermittent claudication. Consistent elevation of systemic arterial blood pressure, sustained blood pressure of 130 or greater, or a diastolic pressure of 80 or greater. Primary hypertension, essential or idiopathic hypertension, generic and environmental factors, affects 92 to 95% of individuals with hypertension. Risk factors, family history, diet, high sodium, low potassium, calcium, magnesium. Tobacco and alcohol consumption, obesity, and glucose intolerance. Secondary hypertension caused by a systemic disease process that raises peripheral vascular resistance or cardiac output, renal vascular or parenchymal disease, adrenocortical tumors, adrenomedullary tumors, and drugs. Complicated hypertension, chronic hypertensive damage to blood vessels and tissues leading to target organ damage in the heart, kidney, brain, and eyes. Myocardial hypertrophy. Hypertensive crisis, rapidly progressive hypertension, systolic pressure greater than 180 and or diastolic pressure is usually 120, life-threatening. Orthostatic postural hypotension, decrease in both systolic and diastolic blood pressure upon standing, lack of normal blood pressure, compensation in response to gravitational changes on the circulation. Acute orthostatic hypotension, chronic orthostatic hypotension. Pediatric cardiac disorders, congenital heart disease, major cause of death in the first year of life other than prematurity. Prenatal, environmental, and genetic risk factors, maternal infection or increased age, metabolic disorders, PKU, drugs, antepartum bleeding, prematurity. Defects classified by blood flow pattern, increasing pulmonary blood flow, causing obstruction of blood flow from ventricles, decreasing blood flow, causing mixed desaturation with saturated blood in chambers or great arteries. Status of tissue oxygenation, cyanotic defects, right to left shunt, acyanotic defects, left to right shunt, defects with increased pulmonary blood flow. Patent ductus arteriosus, PDA. Failure of the ductus arteriosus to close allows blood to shunt from the aorta to pulmonary artery, causing left to right shunt. Manifestations: asymptomatic or signs of pulmonary distress, dyspnea, fatigue, poor feeding. Characteristic: machinery like murmur. Complications: risk for bacterial endocarditis, pulmonary hypertension later in life. Atrial septal defect, abnormal opening between the atria, blood flows from left atria to right atria. 3 major types: ostium primum, ostium secundum, sinus venosus. Manifestations: asymptomatic at early age, pulmonary symptoms on exertion at later age. Ventricular septal defect, opening between the ventricles, the blood flows from left to right ventricle. Most common type of congenital heart lesion. 2 types: perimembranous and muscular. Manifestations may be asymptomatic, increased pulmonary blood flow from left to right, shunt, pulmonary hypertension, Eisenmenger syndrome. Atrioventricular canal defect results from, which is an ABC, results from incomplete fusion of the endocardial cushions, demonstrates abnormalities in the atrial and ventricular septal and atrioventricular valves. Manifestations: left to right shunt and pulmonary overcirculation. Irreversible pulmonary hypertension if untreated. Obstructive defects: coarctation of the aorta, localized narrowing of the lumen of the aorta that impedes blood flow. Manifestations: if severe, decreased cardiac output, acidosis, hypotension. If undiagnosed, no manifestations until hypertension in upper extremities at older age. Aortic stenosis, Narrowing of the left ventricle outlet causes increased workload on the left ventricle and left ventricular hypertrophy. 3 types. Valvular occur related to malformed or fused cusps, resulting in unicusp or bicuspid valve. Subvalvular stricture, caused by a fibrous ring below a normal valve or by a narrowed LV outflow tract in combination with small valve annus diameter at the base of the aortic root. Supravalvular, a narrowing of the aorta just above the valve occurs at a single defect of Willis syndrome. Manifestations: infant, faint pulse, hypotension, tachycardia, poor feeding. Older children, exercise intolerance, risk for bacterial endocarditis. Defects: decreasing pulmonary blood flow. Pulmonic stenosis, narrowing of the pulmonary valve causing resistance to flow from right ventricle to pulmonary artery. Right ventricular hypertrophy. Pulmonary atresia. Manifestations: if severe, cyanosis from right to left shunt through atrial septal defect. Decreased cardiac output, harsh systolic murmur, and ejection click. Tetralogy of Fallot. Syndrome represented by 4 defects: large ventricular septal defect, VSD, overriding aorta that straddles the VSD, pulmonary valve stenosis, right ventricular hypertrophy. Manifestations: acute cyanosis at birth or gradual cyanosis, acute episodes of cyanosis and hypoxia, TET spells, difficulty feeding and poor growth. Tricuspid atresia, failure of the tricuspid valve to develop, lack of communication between the right atrium and right ventricle. Associated defects: pulmonic stenosis, transposition of the great arteries. Manifestations: in newborn, cyanosis, tachycardia, dyspnea, poor feeding. In older child, signs of chronic hypoxia with clubbing. Mixing defects: transposition of the great arteries. Aorta arises from the right ventricle and the pulmonary artery arises from the left ventricle, results in 2 separate parallel circuits. Unoxygenated blood circulates continuously through the systematic circulation. Oxygenated blood circulates continuously through the pulmonary circulation. Other defects allow mixing of these circuits. Manifestations: depends on size and association and dissociated defects. Total anomalous pulmonary venous connection, TAPVC. Pulmonary veins connect to the right side of the heart directly or indirectly through one or more systemic veins that drain into the right atrium. Classified by point of attachment: supracardiac, cardiac, or infracardiac. Manifestations: cyanosis early in life, worsening with vein obstruction. Truncus arteriosus, failure of the embryonic artery and the truncus arteriosus to divide into the pulmonary artery and the aorta, results in single vessel, always associated with VSD. Type 1, 2, and 3 manifestations: asymptomatic with moderate heart failure, variable cyanosis, poor growth, activity intolerance, risk for brain abscesses and bacterial endocarditis. Hypoplastic left heart syndrome, underdevelopment of the left side of the heart, obstruction to blood flow from the left ventricular outflow tract, underdevelopment of the left ventricle aorta and aortic arch, mitral atresia or stenosis, coarctation of the aorta. Manifestations: occur early in newborn, cyanosis, tachypnea, decreased cardiac output, fatal in early life if untreated. Acquired cardiovascular disorders occur after birth. Various causes: infection, genetic disorders, autoimmune processes or diseases, environmental factors. Kawasaki's disease, formerly known as mucocutaneous lymph node syndrome, acute self-limiting systematic vasculitis that may result in cardiac sequela. Usually occurs in children under 5 years of age and in winter or spring. Pathologic stages: 1 is 1 to 12 days. Capillaries, venules, arterioles, and the heart becomes inflamed. 2, 13 to 25 days. Inflammation of larger vessels, coronary aneurysms appear. 3, 26 to 40 days. Medium-sized arteries begin granulation process. 4, 41 days and beyond. Inflammation wanes, scarring of vessels, calcification, and stenosis. Diagnosis: 5 of 6 major findings. Fever for 5 or more days, unresponsive to antibiotics. Bilateral conjunctivitis without exudation. Erythema of oral mucosa, strawberry tongue. Changes in the extremities such as peripheral edema and erythema with desquamination of palms and soles. Polymorphous rash. Cervical lymphadenopathy. Systematic hypertension. Systolic and diastolic blood pressures over the 95th percentile for age, gender, and height on at least 3 occasions. Hypertension in children differs from adults, often has underlying disease, renal disease, or coarctation of aorta. A cause is almost always found. Children commonly asymptomatic, seeing increased incidence of primary hypertension in older children related to obesity.